A lethal respiratory outbreak on board the MV Hondius luxury cruise ship recently forced international health agencies to coordinate immediate contact tracing and quarantine protocols. The pathogen responsible for the lockdown is the Andes Hantavirus. In documented outbreaks, the case fatality rate for this specific virus routinely approaches 40%. A mortality rate that high immediately forces a mathematical assessment of risk. We have to ask what happens if an exposed traveler brings this pathogen into a highly dense urban transport hub, like those found across India. The immediate public reaction, fueled by media coverage, is to map the trajectory of the SARS-CoV-2 pandemic onto this new event. We are going to dismantle that assumption. By mapping the exact microscopic pathogenesis of the Andes virus, we can understand why India's specific public health protocols are structured the way they are. To accurately gauge a pathogen's threat level, we must strip away the sensationalism and examine the strict biological limits placed on its transmission. Most hantaviruses operate strictly as zoonotic pathogens. Humans contract the disease by inhaling aerosolized urine or feces from infected rodents. Once in the human body, the transmission chain stops. We act as a dead-end host. Andes is the only known hantavirus strain that breaks this rule. It possesses the capability for sustained person-to-person transmission. Epidemiology first recognized this capability in 1996 during an outbreak in El Bolsón, Argentina, where contact tracing proved the virus moved directly between humans. This medical schematic shows the primary site of attack. The Andes virus replicates deep within the lungs' alveolar epithelium, causing severe respiratory distress. But it also targets a critical secondary replication site, the salivary glands, providing the biological exit route necessary for interhuman spread. For that transmission to occur, specific environmental variables must align. The virus relies on enclosed spaces with poor ventilation to build up an infectious dose between individuals. The highest risk window often occurs during the prodromal phase. An infected person can pass the virus on before they ever exhibit the classic signs of severe respiratory illness. However, the physical threshold for infection is exceptionally high. Casual proximity is rarely enough. The virus requires intimate, prolonged exposure, such as deep kissing or the direct sharing of bodily fluids. The Andes exception operates within strict biological gates. It is a virus dependent on highly specific, intimate biological exchanges. High mortality rates reliably trigger public panic because we associate lethality with global pandemic potential. This split-screen dashboard compares SARS-CoV-2 on the left with Andes virus on the right. SARS-CoV-2 disperses widely via aerosols, while Andes requires tight physical proximity. COVID-19's rapid incubation accelerates contagion, whereas Andes' long 1 to 8 week incubation severely limits secondary cluster formation. This brings us to a well-documented epidemiological concept known as the lethality paradox. Viruses with mortality rates approaching 40% tend to incapacitate their hosts rapidly upon symptom onset. The host becomes too severely ill to utilize public transit networks, effectively isolating the virus before it can establish a widespread chain of infection. The resulting illness also looks entirely different at the cellular level. SARS-CoV-2 destroys lung tissue directly. Andes virus, however, initiates a severe immune cascade. The host's own immune system overreacts, causing massive amounts of fluid to leak across the cellular membranes into the lungs, the defining characteristic of hantavirus pulmonary syndrome. Extreme lethality acts as an epidemiological brake. The Andes virus is devastating to the individual and their immediate contacts, but it lacks the biological mechanics necessary to sustain a global pandemic. If an exposed passenger lands at a major Indian point of entry, the public health system has a specific protocol to intercept them. India's legacy framework, the paper-based Integrated Disease Surveillance Program, was too slow to effectively trace a pathogen capable of a 42-day incubation period. This network flowchart maps the active replacement, the Integrated Health Information Platform, or IHIP. It provides the digital infrastructure necessary to manage long incubation threats. IHIP processes real-time web surveillance and utilizes GIS geotagging to generate automated alerts for 33 distinct epidemic-prone diseases across the country. Once a potential exposure is flagged, the system enforces a strict clinical boundary between quarantine and isolation. For exposed but asymptomatic individuals, the protocol is quarantine. Because of the virus's biology, this requires a mandatory 42-day monitoring period, matching the maximum limit of the pathogen's incubation envelope. If an individual develops symptoms, they are moved to isolation. This requires immediate transfer into an airborne infection isolation room. Inside that room, healthcare workers must adhere to rigid personal protective equipment protocols, including N95 respirators, face shields, and fluid-resistant gowns to prevent nosocomial infection. Defeating a slow-incubating, highly lethal pathogen relies entirely on the precise mathematical application of digital surveillance and extended physical quarantine. This infographic outlines the current pharmacological reality. There is no approved vaccine and there is no specific antiviral treatment for the Andes virus. Survival relies entirely on aggressive supportive care in an intensive care unit, specifically focusing on mechanical oxygenation and extracorporeal membrane oxygenation, or ECMO. Because post-infection options are limited, environmental prevention remains the primary defense in endemic regions. The most common point of failure is mechanical dry cleaning. Sweeping or vacuuming an area with rodent droppings aerosolizes the viral particles, directly initiating zoonotic transmission. To neutralize this threat, protocols dictate the strict use of wet cleaning methods, utilizing disinfectants to suppress aerosolization entirely. Preparedness outpaces panic. The Andes virus is a highly lethal pathogen capable of exploiting close human contact. But because we understand its biological constraints, and because systems like IHIP exist to map and isolate exposures, outbreaks can be systematically intercepted and neutralized.